Let's look at some leg lowers now. I see leg lowers probably as a progression on from the knee fallouts and the leg slides because they often require just a little bit more awareness of your breathing pattern, pelvic floor, and your limb position in space. So if you find this too challenging, then just leave it out. So we lie on our back, and we're going to be lifting our legs up. So don't lift them both up off the floor together. You'll find that creates a big amount of stress through that tummy and pelvic floor area. Lift one up, and instead of leaving it at 90 degrees through your thigh, I'm going to get you to bring it in a little from that position. And I'm going to get you to hold that leg with your hands. Press your leg into your hands, so counter or resist with each of them. And that will make the other leg feel quite light to lift from the floor. Again, rather than starting with the legs vertical, I want you to bring those legs in a bit. It's a much easier position to manage that through your lower back. All right, so we start in this position. Our hands, I'll show you holding the front leg, are going to wrap in behind, just below the knee, behind that leg. And we're going to create a little bit of pressure of the leg into our hands. You're going to set your shoulders down your back and relax the back of the head into the floor. You take a breath in, into your belly, and then as you exhale, start by lifting up the pelvic floor and setting through the lower tummy, and then continue that out breath by lowering your leg down. Stopping, taking a little breath in, and then as you breathe out, really lift that pelvic floor, set the lower tummy, and bring the leg back up again. You take a breath in. As you exhale, set the tummy, pelvic floor, lower the leg down nice and slowly. Take a little breath in, and then exhale, pelvic floor, lower abdominals on, and bring it up. So it's done really slow and controlled. Important not to feel any sense of pressure or heaviness through the vagina. So you've got to try and actually feel that pelvic floor lift and feel that you can control that lift through the movement. So at any point, if you feel you're losing that, you can try just reducing how low you take the leg. But if those small movements are still quite challenging and you're unable to sustain that lift through your pelvic floor, then you're not ready for that one. So just stick with the first two exercises. So these ones are our leg lowers. I'm going to show you again. I'll show you on the other side. One leg lifts, bring it in, support with your hands and resist. Slowly peel the second side off. All right, make sure you're getting that breath into your tummy and rib cage. Then as you exhale, holding on, supporting that leg, we lower one leg, setting tummy, pelvic floor. Take a little breath in. And then as you breathe out, set tummy, pelvic floor again. And bring that back. Notice how slow I'm doing it. Breathing in. Exhale, lift through your pelvic floor, slowly lower. Stop for a little breath in. Exhale, pelvic floor, lower tummy, come on. I also like in between repetitions just to take a moment, it can be an extra breath even, to try and drop the tension so that you're not constantly holding the whole time. So you want to try and make sure that that rib cage and the neck and shoulder area kind of melt back into the mat as you do it. So that's your leg lowers. To get a little bit more challenging as you strengthen with that, you can support less through the hands into the leg, and instead of having the legs in from the vertical, they can slowly move to a more vertical position. Finally, let's have a look at the small range chest lifts. Now, I think over the years, whether or not to do a little curl up or chest lift has been a fairly debated topic. But I think now the consensus is really that movement that can be done well controlled without doming your front tummy wall and with good sense of pelvic floor lift is fine, and making sure that you're teaching your clients the correct way to breathe and to feel those muscles activate. So we'll start with the chest lift. We're going to keep our feet on the floor. All right, and make sure that with this, that when you're first starting, that you're doing chest lift and then you're also having a break between each repetition so that you're really getting your attention back to how you're breathing in preparation for the next one. So we lie down, feet again about 30 centimeters away from your bottom with that same gentle curve in your lower back and making sure that rib cage feels soft through the front. Now, support or feel what you're doing, feel the movement through either hands on this midline area, or you might like to put one over your perineum so that you can really feel that sense of trying to lift through your pelvic floor when you're about to do that chest lift. We're going to do this with 2 breaths to start with, and then you can strip that back and just do a single breath through the movement. So the breathing will be breathing into your tummy without moving at all. Then you need to start your out breath before your rib cage starts moving. So there should be no movement of the rib cage or head before you've actually started breathing out and started to lift and get a strong lift through that pelvic floor with this one, okay? So I'm going to just leave this hand down so you can see what I'm doing through my tummy. So you take a breath in. Then you start the out breath. So I'm going to cycle that breath by lifting up through my pelvic floor and feeling like I'm zipping up pelvic floor and lower tummy. And as I continue to breathe out, there's still got to be some air left. I'm going to move my chest lift from my rib cage. So not lifting from the head. The head relaxes back. Where the abdominal muscles attach should be the point that moves first. So we breathe into our tummy. As we exhale, we feel our pelvic floor lift and tummy set, and then our rib cage follows through. We take a breath in here, not too big. And then we exhale again. Pelvic floor, tummy tighten, and we control the lowering down. Then we take a breath to sink and relax. So it's inhale to your tummy. As you breathe out, get that lift through your pelvic floor, zipper comes on, rib cage moves towards your pelvis. A small breath in, and exhale to lower. Breathe in, exhale pelvic floor. Little breath in, exhale, set, and lower. Now while I'm doing that, there's lots that I'm thinking about. I'm thinking about making sure that I can feel my pelvic floor come on and hold as I come up. And then I'm also feeling and checking that I'm not getting that doming or bulging up through the center of my tummy. Also, when we do this, our rib cage shouldn't grip in and it shouldn't come out here and spread wide and brace out to the sides when we're lifting up. So that indicates then that we're using our oblique abdominal muscles. So we're trying to make sure the rib cage really should move out a little as we breathe in, and then just sink back slightly as we do our exhale and hold its position through the movement up. When we get to the top of the movement, as you do a breath in, make it a small one so that you're not really then completely relaxing out that tummy wall. So we're just going to take enough of a breath in that will allow us to do a breath out as we lower down. As you feel you're getting a little bit better control of that movement, that you can change your breathing to exhale to lift and then inhale to lower down. You'll also notice that I don't come up very far at all, so no higher than the bottom of my shoulder blades. And the other important thing is the position of the pelvis should not change from what I call neutral. So when we have just that gentle curve in the lower back, as you come up into a chest lift, there should be no rolling and tucking like this, because that tends to, you can feel the difference of the pressure that it puts down through that pelvic floor. And as we tuck like that, I feel it often tends to then make the outer, the rectus abdominal muscles really dominate the movement. And I'm wanting to feel that lovely broad sense of activation into the deeper transverse abdominal muscle as well. So try not to change the alignment of your pelvis as you're coming up and down.